One of my priorities coming to the University of Rochester was to expand the clinical ethics program. The University of Rochester is the home of the biopsychosocial approach, which embeds clinical ethics throughout all clinical patient care. Margie Shaw runs our clinical ethics consultation service as well as our ethics committee.
Hi, my name is Margie Hodges-Shaw, and I'm the director of the Clinical Ethics Program at the University of Rochester Medical Center, and I'm delighted to introduce you to our program. We support providers, patients, and families to make informed decisions that respect human dignity and promote the best possible outcomes. Jane Greenlaw started our ethics service in 1991 to help individuals in the institution resolve ethical dilemmas that happen in the hospital. And since that time, as clinicians have found how helpful it is to have ethics support, our services have grown. We have Strong Memorial Hospital's Ethics Committee, which is a robust interdisciplinary committee that includes members from our community, from the greater Rochester community. We have an ethics team, which is an interdisciplinary team that meets weekly to support the clinical ethics consult service. And we have a clinical ethics consult service that responds to 24/7, just like any other consult service, ethical dilemmas and moral uncertainty that happens in the hospital.
I think the ethics consult service helps people to think about patient experience and staff experience from multiple different lenses. So both from the provider side, from the family side.
Our clinical ethics team is an interdisciplinary team that's made up of individuals who have spent time learning about ethics, and they have done fellowships and they are certified as ethics consultants. It's a terrific team. We come together and help each other and support each other as we think through the issues that arise, the complicated issues that arise in clinical care. We bring our different perspectives and our different experiences to make sure that we consider all of the possibilities of how individuals could think about these moral dilemmas. I am delighted for you to hear from my colleagues about what our program has to offer.
I think the most important thing to me regarding the ethics program here is the ability to sort of have a very multidisciplinary team and get to see parts of the hospital and parts of medicine that I would otherwise see as a surgeon. And I think that it both helps me with my practice of medicine and also informs some of the parts of ethics that may not have a surgeon involved traditionally. And so I sort of bring a different perspective to things, both to the ethics committee and the consultations that we do.
My engagement in the clinical ethics program is important to me because as a nurse and now as a nurse practitioner, I really want nurses and APPs to have a voice at the table of ethics, not only to understand what ethics is and how they can participate, but how they can impact patients' lives and all of our peers.
My engagement in the clinical ethics program is important to me for a number of reasons. One of which is it brings great value to me. I really enjoy the discussions that we have. I think it makes me understand the decisions that I make when I'm a patient's physician and not their ethics consultant better. I think it actually allows me to see different parts of medicine that I wouldn't see otherwise because I get to engage in all aspects of the care at Strong Memorial Hospital, not just what's happening in the adult intensive care units. And I really enjoy my colleagues in clinical ethics and being able to discuss different patient situations with them.
So my engagement in the clinical ethics program is important because in my practice in palliative care, there is a lot of intersection between ethics and palliative care, and so to be well versed in one helps you to practice the other better. Also in pediatrics, there are a lot of unique ethical issues that come up in the field, and so to have more exposure to and education in clinical ethics makes me feel like I'm a better pediatrician.
It's really helped me to bring ethics to nursing leaders, and we've also helped to elevate ethics in nursing overall through this program. We have started a nursing ethics subcouncil as part of our professional nursing council. We have also started to participate in the clinical ethics certificate program, so we're doing a lot of work to elevate ethics in nursing, both at the bedside and in leadership.
So people should call the clinical ethics team whenever there's moral uncertainty or there's a dilemma or moral distress in the care of a patient. And so we appreciate when those calls come early, when these are first identified, but we'll respond to a call whenever the team feels that they have a need for our help.
Over the years, as ethics consultants, we've learned that many people don't know that ethics support is available to them within their institution. So one thing I would like people to know is just that you have an ethics team that is available 24/7, 365 days a year to respond to ethical questions, ethical concerns, active issues with patients, to help provide debriefs when something has already happened. So just knowing that we are there is a big part of it. We are there as a support mechanism. We are part of the multidisciplinary team. We are just there to help everyone think things through and come to a decision that balances clinical expertise with the patient and or their family's values and preferences.
At our institution, anybody can call an ethics consultation, whether they be a member of the healthcare team, a patient's family member, or the patients themselves. Those who are employed by our hospital can use our web paging services, and anyone else could also use the operator or the paging system to call us and request an ethics consultation. There is a tremendous buy-in for the value of clinical ethics consultation at this institution.
I would just say my experience over the years has been nothing short of extraordinary. Honestly, they are always available for many different reasons. Sometimes I have called them because there's a question that I have and I just need to be educated on certain policies and procedures, or educated about the New York State laws around surrogate decision-making or other things. And they are always available to kind of take calls, provide education, give us reassurance, clarify things. And I've also called them many times when there's been questions about patient care where it's difficult either because there's conflict with the team members and the patients or their surrogates. And they've been available to come by, often very accessible, and they will come walking down and be available right where you are if they're around. And they will have conversations with you about what is going on, interview other team members, and provide recommendations and guidance based on their thoughtful, careful listening to us. And they also will provide more formal consultations involving family members, depending on, I think, the depth and the needs of the situation. Numerable times have they come by and kind of provided us with that type of guidance and support that I think our team benefits by, and I certainly know our patients do too.
It's a great team. They work together beautifully. They think through these just impossible problems in a very systematic and fair way and address all aspects of fairness on an individual basis, on a societal basis. They come together, talk about the patient, invite us to talk with them about the patient.
In the ICU, we utilize the ethics consultants quite frequently. We usually utilize them through a paging service, and every time we've had to communicate with them, they have been prompt, extremely respectful, and also they really care about the information and the input that we want to have as nurses. I think the service that they provide for this hospital is invaluable because of just the care that they're able to kind of close the loop on, right? A lot of times we have extra questions, patients need extra care, families, need a little extra reassurance, as well as the provider team. And I think having the ethics consultant group here really helps provide that little extra piece of care that really makes our medicine the best, and really brings it to the highest order.
It's an invaluable service, and I think it helps our families tremendously. I think it also helps the team think about what's important in terms of what the family wants or what this person would want.
They're very supportive, and they have a wide range of knowledge on these situations, both in the legal sense and the compassionate sense, to make sure that both the staff and the patients feel supported. The service is deeply valuable to the healthcare of our patients, and as great advocates, and just making sure that we all are looking for everyone's best interests.
The ethics team is here to support you, all of our providers, our family members, and our patients to make the best decisions in patient care.
It is an exciting time in the Department of Health, Humanities, and Bioethics at the University of Rochester School of Medicine and dentistry. Clinically, we're expanding our clinical ethics consult service. We're expanding with more huddles at Strong Memorial Hospital and Golisano Children's Hospital. We're expanding the number of faculty who provide clinical ethics consultation.